Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Tricia Julian, Oncology Nurse Navigator with Mon Health Medical Center. Tricia, good morning.
Good morning, Dave. Thank you for having me.
Appreciate you taking some time. And Jeffery Sandy with HealthWorks Rehab and Fitness Director of Specialty Programming and Revital Program Director. Jeffery, good morning. Thanks for stopping by.
Good morning. Thanks for having me.
I appreciate it. We're going to get into today's topic. Cancer rehabilitation and revital will be the topic, but we'll get into that in just a moment. But first, we like to get to know our guests just a little bit better. We'll start with you, Tricia, since your name just happens to be first on the list. Tell us a little bit about your background, where you're from, where you went to school, and how you got associated with Mon Health.
Well, I live in Fairmont. My education background is Fairmont State. Both of my degrees are from there. And I originally worked at Mon in the 80s and 90s, went to Fairmont because I have 4 children and wanted to have holidays and weekends off there, but I got a chance recently in the past 5 years to come back to Mon, and this is where I really wanted to finish out my my career. So I jumped at the chance to get back here.
What got you interested in the healthcare industry to start with?
Well, my grandfather was a doctor. I have my mother was a nurse. I have several aunts and family members who are in the medical field, and I think that probably prompted my interest in it.
And Jeff, same to you, background, education, and how you got hooked up with HealthWorks.
Yeah, so I'm originally from Buchanan, West Virginia native. I went to West Virginia University, got my undergraduate degree. Then I went to Chatham University in Pittsburgh and got a master's in biology, and then my doctorate in physical therapy at George Washington University in Washington, D.C. I've been a physical therapist now for over 10 years. Love every minute of it. I have experience in inpatient rehabilitation and now in the outpatient field. And what really got me interested in physical therapy was I had a family experience where I had a family member that got very ill and had extensive physical therapy, and that exposed it to me and made it something that I wanted to pursue.
Yeah, I hear a lot of those stories, Jeff, especially with physical therapists, but also nurses and different doctors as well. You have some sort of experience, whether you went through the physical therapy or somebody close to you did, and that sparks a curiosity and eventually leads to a career.
Yeah, absolutely. I knew I wanted to do something in healthcare, but I wasn't exactly sure what, whether it would be physician, physician's assistant, any of those great fields that there are to go into, nursing like Tricia, but ultimately landed on the physical therapy route.
All right, Tricia, you're an oncology nurse navigator. What is that?
An oncology nurse navigator connects with the patient at the beginning of their cancer diagnosis and tries to help navigate them through the process, hence the name. And so we will get with patients, excuse me, like I said, when they're first diagnosed, maybe help get things arranged for appointments. I do all of the education for newly diagnosed patients up here in the infusion center, and that gives me a lot of background information on them, on finances and different ways that I might help point them in a different direction to specific things within our program that they might need.
And I can't imagine getting that diagnosis, and you have that the realization of that diagnosis, and then the appointments and everything, the treatment plan, et cetera, to set up. And it sounds like you really are able to step in and kind of shoulder some of that burden with the patient.
It can be absolutely devastating, Dave, and we see patients a lot of times with that deer in the headlights look where they just don't even know what to do next. And so, honestly, I've been doing oncology nursing for over 40 years, and that is my favorite part of my job to take a patient who is terrified with that new diagnosis, arm them with education to be able to get through the process and help them along the way.
So when we're talking about cancer treatments, people probably think about chemotherapy, radiation treatments, maybe a surgical procedure that needs to be done in there as well to remove the cancer. So where does physical therapy, Tricia, factor into the treatment plan, and where will the rehab process start?
Well, patients can experience direct results of the cancer itself in many different ways, but additionally effects from the treatment of the cancer. We can do things, for instance, like beginning therapy with Jeff and his team prior to treatment in breast cancer to diminish post-surgical side effects. Fatigue is a very impactful side effect that is experienced by virtually 100% of cancer patients to some degree, and it can be diminished by a program of physical activity. They can take a patient and work with any level of activity or ability and help them get a great deal of benefit from that movement and that exercise. The impact of exercise on cancer cannot be underestimated. Not only can it decrease fatigue and increase strength, but it's been shown to actually decrease recurrence in several types of cancer. So I feel truly, truly blessed to have the Revital program because we've seen so many success stories with it.
All right, Jeff, what is the Revital program?
So the Revital Cancer Rehab Program is a national program that's offered in our area exclusively by HealthWorks, and it was originally created to address patients with breast cancer, as Tricia mentioned. However, it has since expanded to treat all cancer types. What we were finding is that upwards of 90% of patients that have cancer or undergoing cancer treatment will experience at least one negative side effect. But of those people, less than 2% were actually getting those issues addressed. So we really found that there was a large need for a specialized rehabilitation that could address those needs that are in many ways unique to cancer. As Tricia mentioned, you have the fatigue, but then also things like chemotherapy-induced peripheral neuropathy, which is numbness and tingling that often starts in the hands and feet and can actually progress over a larger area. But that can be very debilitating for people and really start to impact their quality of life. And at the end of the day, that's really what it's all about for the medical team and us as the rehab team, is just keeping our patients, number one, we want them to survive, but number two, we want them to have the best quality of life possible.
Our guests this morning, Tricia Julian, Oncology Nurse Navigator, Mon Health Medical Center, and Jeff Sandy, HealthWorks Rehab and Fitness Director of Specialty Programming and Revital Program Director. Got to take a quick break. We'll continue our conversation on the other side. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning, Tricia Julian, Oncology Nurse Navigator, Mon Health Medical Center, and Jeff Sandy, HealthWorks Rehab and Fitness Director of Specialty Programs and Revital Program Director. And Jeff, can you give us an idea, and I know we're speaking kind of in broad terms here, but can you give us an idea of what a patient will do, what the program with Revital consists of?
Yeah, so as you mentioned, it's obviously going to vary extensively person to person. So we very much take an individualized approach. There's no cookie-cutter approach that works for each patient or each individual. It's obviously going to depend a lot on the type of cancer, what types of treatments they're receiving, what side effects they're experiencing, and also significantly where in the process they are. So oftentimes we may see patients, as Tricia mentioned, before they ever start treatment, kind of in a prehab fashion, during treatment, or into survivorship, which means they've finished their treatments, maybe their cancer's in remission, but they're still experiencing some of the negative effects. So it is going to vary based on those factors. However, generally what someone can expect is when they come in the program, they're going to have an individualized initial evaluation. So that will involve some question and answer, objective measurements, so looking at range of motion, strength, balance, numbness, tingling, grip strength, all those different components. And from that information, then we form what we call a plan of care, meaning that we're going to see you 1, 2, sometimes 3 times a week, maybe every other week, and for so many weeks, and then we'll reassess that and see how you're progressing and adjust your plan from there.
So who would be eligible for the Revital program?
So anyone that is either been recently diagnosed and has yet to begin treatment, all the way to people that are what we call in survivorship. And kind of in honor of cancer, so June is Cancer Survivorship Month, so we think a lot about those people during this month. And I've had patients that have come to me as late as 3 or 5 years or even longer after their treatments have stopped. And we've been able to significantly help them, even though it's been some time. So it's never too early or never too late. It's really when you need us, but the ideal time is as soon as possible.
And Tricia, can you go into a little bit more detail the personalized care that the patient is going to receive? You get this diagnosis at Mon Health, and it's not just kind of like Jeff said, it's not a cookie cutter answer to the treatment program, treatment plan moving forward. Each patient is going to get a personalized and individual care.
They are, and we take pride in treating the patient through the entire trajectory of their cancer experience, as Jeff said, including survivorship. We have staff and programs for every phase of their cancer journey. And I also wanted to mention that what makes it very convenient here in Morgantown is that if our patients are being treated here at the hospital and need to go for a Revital visit, it's right down at the bottom of the hill. So it's like a one-shot deal that they have to come to this area and can be treated and then go for their Revital treatment. And Jeff will probably mention this, but we have offices in other cities as well that can be a problem for patients when we're so geographically isolated sometimes, and patients need to have those treatments near them.
Jeff, do you get patients that maybe they're a little skeptical at the beginning, going, all right, I'm tired from treatment. Exercise is going to make me less tired. Okay, I'll do what you say, Jeff. And what are the reactions later?
Yeah, absolutely. So sometimes the hardest thing is to get someone to take that first step and get in the door. And oftentimes then once they get started and they start to notice some of the benefits, then they really kind of get into it. And it's pretty cool to see. We had one patient that she was in survivorship, so she was no longer receiving active treatment for her cancer, but so many of those negative effects. She had significant pain, weakness, fatigue, limited range of motion, and she was even taking painkillers to deal with some of those negative effects. And she was skeptical. It took her a couple months to finally get in the door. And then once she got started, she's never looked back. She's no longer on painkillers. She's no longer on any type of antidepressant. She's active. She's enjoying her family. So it's really neat to see those instances where people may be skeptical, and then when they start to see the positive benefits, it really changes that mindset, kind of flips the switch.
You know, Jeff, I don't want to say necessarily obvious, but there are obvious physical benefits to exercise during treatment and after treatment when cancer's in remission. But what about the mental side of things as well? Are there mental health benefits that go along with the exercise as well?
Absolutely. So we know that from research that exercise in many ways helps to support a positive mood and just makes people feel happier. There are hormones and different enzymes and things that are created by the body when you exercise that help to boost mood, put people in a better place, and then that kind of causes a positive cascade of, I feel a little better. Now I'm going to go have lunch with my friends again, or I'm going to go see my daughter play soccer again. And that kind of, you just see that confidence and that positivity build. And it really can have a positive impact not only on the physical, but the mental and emotional aspects.
Our guest this morning, Jeff Sandy, HealthWorks Rehab and Fitness Director of Specialty Programs and Revital Program Director, Tricia Julian, Oncology Nurse Navigator at Mon Health Medical Center as well. Tricia, in your role as Nurse Navigator, is it I don't know, gratifying or satisfying to see people through their journey, and when they do beat cancer and they go into survivorship, how that's got to be gratifying on your end to see these people come through this very difficult journey.
That's probably one of the things that has kept me in this field. Excuse me, for as long as I've been in it. People ask me how I have survived being an oncology nurse for as long as I have, and the answer to that is hope. I've seen things change so much in the past 40 years, and we truly can treat many cancers now the same way we treat chronic illnesses like diabetes. There are so many treatments that if one fails, we've got another one in the wings. If that one doesn't work, then we've got another one to try. So I see so much positivity, and the addition of the rehab is just, I just can't emphasize enough what a positive thing that's been to help patients through this whole process.
What kind of reactions, Tricia, have you heard from patients who have gone through the Revital program, gone through the whether it's prehab and rehab process during cancer treatments? What do they tell you on
Well, I can tell you of one instance that's a very good example of how things go with the program. There was a patient who had severe peripheral neuropathy. It was so painful for her to even walk, and that was partially, I believe, due to diabetes, but then she had chemotherapy, and that intensified it. And she was skeptical about trying the Revital program, but she did. When she left, she was in tears because her pain was diminished so much. So I hear story after story like that, and like Jeff said, when you tell a patient who's so fatigued, you need to exercise, they look at you like you're crazy. It sounds so counterintuitive, but I've seen those patients that they've worked out a program for them that's doable for them, and they come back with extra energy, with a feeling that they can get through the rest of their treatment. So it's been extremely rewarding for me to see those outcomes.
Yeah, Jeff, don't have much time left, but it does sound counterintuitive. If you're tired and in pain, why would I want to go exercise? But the benefits are there. If the patient just trusts you for just a minute.
Yeah, absolutely. And, we've seen that anecdotally. We see that in the research. And the biggest thing that I tell patients is with cancer, there are so many things that are outside of your control. You really don't have control of a lot, but this is something you can control. This is something you can do to positively impact your survival, positively impact your quality of life, and kind of take ownership of your health and empower yourself and beat this thing. You can do it.
You can get more information at monhealth.com/cancer. Jeff Sandy, Tricia Julian, thanks for joining us this morning. I appreciate it.
Thank you very much for having us.